Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I'd like to talk about chin rejuvenation. This is a topic near and dear to my heart, but not something that people come in asking about very often. There are so many people who can benefit from a tweak to their chin. There are some people who just have small chins, and they can have chin implants done by a plastic surgeon, and that is really not something that I'm qualified to discuss. I'm a board-certified dermatologist, and I tweak people's chins every day for subtle but important results, and I'd like to talk about the issues that I see and how I fix them. I occasionally do see people whose chins are receded, mostly from a very strong muscle, the mentalis muscle of the chin that pulls the chin up. And they often come in asking me for chin filler, but what they really need is Botox. And if I can explain it properly, which I usually do, I talk them into letting me put just a little bit of Botox into their chin as a trial. And it typically fixes the entire issue, and they are so happy and thankful for the smaller, simpler, less costly procedure. The downside is that Botox does not last very long, so we do need to repeat it every 3 to 4 months or so. However, when the overactive muscle is the problem, filler just will not fix it. And this type of patient truly needs Botox, and it's very satisfying to help these patients in this way. This is an off-label area for Botox, meaning that it's not FDA approved there, but I do it all day, every day, as many other doctors do, and it works incredibly well. I have 2 whole podcast episodes on Botox, one on Botox basics, and one on advanced Botox, which addresses off-label uses such as the chin. And if you want to hear about Botox, generally speaking, in depth, I would recommend listening to those 2 podcasts. For this type of patient, if the Botox is not enough and they would benefit from chin filler, then we can do that. And typically, if I'm going to do chin filler to make the chin larger or get a better profile, then we do that with fillers such as Voluma or Volux, which are firm and great for this area. This is a quick and easy office visit, just like any filler. And I just remind people not to have any dental work within 2 weeks before or after, since the filler is going in fairly deep. And while I have not seen this, infections have been reported associated with deep fillers and recent dental work. The risks of filler in the chin are mostly just bruising, and it hurts a little bit, and I do recommend numbing cream in advance of this injection to take the edge off of it. But it's not that bad in terms of discomfort, and it can be done with no numbing cream. There is a whole episode on fillers to listen to if you are interested in hearing more about fillers in general. And just a quick reminder about fillers in the chin that an alternative that is more permanent would be a chin implant with a plastic surgeon. The other type of patient that I would like to discuss is basically most female patients that come in for anti-aging treatments over time. Almost all of us eventually end up needing some Botox in our chins, and often some superficial fillers for the fine lines and wrinkles as well. Let me explain. The mentalis muscle of the chin is active and gets stronger as we age. Why that happens, I do not know, but I do see it every day. So as patients are talking to me, I see their mentalis muscle crunching up and causing wrinkles in their chins. I mention it often, and they usually have no idea what I'm talking about until I give them a mirror and make them either frown or talk into the mirror, and then they see it. But they have truly never noticed it before because at home they do not talk to themselves in the mirror, and people don't usually take selfies frowning or while talking, so they're not aware of it in photographs. Once I show it to them, they get it because you can see the crinkle, for lack of a better word, and if left untreated, it's pretty easy to imagine how this crinkle becomes what I call orange peel chin, with lots of little bumps and wrinkles on the chin over time. It's just a few units of Botox to fix this, and then we need to maintain it every 3 to 4 months or so. Once the muscle is calmed down and the crinkling is minimized, many patients still have some fine lines and wrinkles in their chin that benefit from fillers, and so we will often do fillers for the fine lines and wrinkles, and often they will also have some volume loss, which we also correct with fillers. The volume loss, the fillers are a little bit deeper. The fine lines and wrinkles, the fillers are a little bit more superficial. For details on this, I do recommend listening to the Fillers podcast. But this type of patient that I'm talking about is very different from the person who truly has a receding chin and needs either deep fillers plus Botox or a chin implant. The type of patient that I'm discussing now is the majority of aging women who do not want to get wrinkly chins or large muscular chins, and Botox and fillers help prevent and treat this area. Of course, good skin care is always necessary, and sunblock with reapplication, retinoids at night, among other good anti-aging options, can also help with chin rejuvenation. There's a whole podcast episode on basic anti-aging skincare advice if you are interested in that as well. So, in summary, the chin is a specific area of the face that is often overlooked and needs attention. I split the patients into a minority of people who have recessed chins that need Botox to relax the muscle, or Botox and deep fillers, or a chin implant. The vast majority of patients just need a little tweak, or as we like to call it, a tweakment, with a bit of Botox and often a small amount of fillers to smooth out their chins and prevent deeper wrinkles and volume loss over time. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.